The BioBank is really critical in terms of researchers for the Cancer Center. We procure tissues, we preserve tissues as well as distribute tissues for many members of the Cancer Center.
Every single sample that is placed into this biobank that becomes a resource for us is helping us in our fight against cancer.
We have a critical role in working with clinical trials, so we help investigators who are gathering materials together. We sometimes store these in our freezers and then distribute these.
It's absolutely essential for the future of cancer therapeutic development that we have access to patients' tissue now so that we can test the agents that might be more effective in the future.
The lab is set up in such a way that the privacy of each individual patient is really safeguarded, and so information does not really get out of this area in terms of the use of these tissues when these tissues are being used by investigators.
The research in our lab is really focused on finding better markers to identify, diagnose, and prognose prostate cancer.
Samples like this have allowed us to realize that not all cancers behave the same. Some may actually be treated very successfully with relatively straightforward, simple means. Others require more complex therapies. And these types of anonymous tissues that are provided to the tumor bank provide a resource for investigators to learn more about these growth patterns.
A lot of labs aren't able to have the access to human tissues, and it really is a huge, huge advantage for those labs that do, because ultimately human tissues are what we're looking to treat. So being able to use human tissues in our research really gives us the most accurate markers, or the most promising markers.
The consenting process is extremely simple for patients. We're already signing them up, consenting them for their surgery. We go through the consent for the biobank. They have to sign in a couple places, and that's it. And then the rest of it is pretty invisible to the patients. The other part that makes this really easy is that it's not that we're doing any additional procedures to get this tissue. It's all tissue that already would have been removed for a biopsy or an operation. We're not resecting additional tissue, removing it to get tissue for the biobank. Knowing that that would be tissue that would be completely unutilized and now may help the next generation of cancer patients is a super easy sell for our amazing, good-hearted patient population. And I also think there's this part of it where it is clearly a gift to patients to feel like they may be making a difference for the next generation.